it's just good for yourself. It's good for assessment. It's good for
Why don't you
exercise
stand up
for
and get off your
clients.
gluteus
Get off your
maximus.
ischial tuberosity.
But yeah, get off your ischial tuberosity and see if you can do this with Lou.
So visually, you know, we used to use this because I can see how much a person's foot is clearing the ground, right? But then a client can also feel. You should feel that one foot is easier to lift than the other. And so it's just trying to bring it up into dorsiflexion. And not letting yourself, because here's how people will trick you. They can use their hip and pelvis to cause this. Because if you can't do that, then you have to start adapting at the hip. And so people will get all kinds of interesting gait stuff where they'll have like a quicker, like they'll use this kind of a hip thing. But it's more common to get more of a waddle going on. But anyway, that's all it really comes down to. There's this.
Now that muscle doesn't attach, doesn't have anything to do with the knee. It attaches below the knee.
Yep. Now, I'm cautious with having a person learn to just go up into plantar flexion. You can just take a step forward, and then you can do both together. Here's this one. And I want to get up over top this is where the toe orientation becomes essential for all this, is that in order to even, in terms of gait, regularly perform plantar flexion, my toes have to allow for
They gotta bend.
toe extension. Now I'm not activating my toe extensors, it's passively occurring because now the flexors will kick on to give me that push off. But we can play with both. You know, there's a knee to incorporation, but here's where I can, if I was concerned for a client, I could say, here's the plantar flexion piece, do one at a time, kind of a deal. Dorsiflexion, this is the one usually people need most. They're going to be way too dominant in plantar flexion. They need more here. So this is usually the one that they really just need to do, is learn to regularly do this. In terms of toe stuff, if I'm here showing you little tidbits and tricks, is not just toes up, toes down. Try big toe up with little toes down. Big toe down, little toes up. And as well as the spreading. But sometimes that's really frustrating for people and will cramp. The way to kind of initially get some of that toe dexterity figured out is that. Big toe down, little toes up.
Here, sit, take a sock off, show them how beautiful your toes are.
I don't know about that. Why am I showing that?
He can really spread his toes apart.
So that one's not as good. See, my left foot got injured really bad. So my right can do a lot better, a little bit more uniform. I struggle with the second and third. But yes, there's the spreading that you can try to incorporate too. But that ability and just keeping the structures, when we look at more of the anatomy of the toes and into the foot, making sure that interface of the toe to the ankle and then even like the long bones here, that's how I'm creating, at least here, I'm getting some kind of separation rather than training all these muscles related to the toes to always fire together. And that's the tendency. A person, over the course of time, your foot just kind of becomes one big paddle. And it's like the ankle and the foot and all the toes are essentially stuck together and are independently functioning. So when we do a massage, it's important to move all of those. So I get myself back together. And a lot of that can be done through those. We did all that. Doing this, we at least get the toes up into extension, which is usually what people need more of, but they can't get that big toe. That big toe doesn't allow for extension. There's an arthritic component there that we need to be careful, but we should be able to get to a stride where it's just my toes contacting the ground and that not being feeling like too much strain, right? If a person can't do that, then it's interesting. Now I can feel, for example, my right big toe, there's something tighter there, right? If I compare my left ankle, it feels heavier, feels harder to bring that one up. And that's just a way I can dissect. And then the thing is, I do a little bit more of that But then from a therapist perspective, we go a step further. The only other one, since we're going through all of this for stability stuff, going into gait, and if your balance isn't the best, or the client's balance isn't the best, they just need something to contact, table, wall, anything. And this trains a couple of things. Since people need to be stronger in dorsiflexion anyway to clear the ground, right? So they have to hold their foot there. They have to hold it in dorsiflexion. And then we're unlock that knee a little bit. And then we're just gonna do leg swings while keeping our toes pointed forward. So the toes don't wanna wing out. The way this looks wrong, again, with people using the pelvis, is they'll kind of wing out like that. And that'll be how they're like, yeah, of course I can do the leg swing. So it's like, but then that tells you something's up, right? So this is what the leg is supposed to do. If we incorporate upper body, if you're feeling brave, then this mimics here. And so the weird interaction is that we're not using a lot of rotation per se when we do this, right? I don't internally rotate my leg and then take a step. There's mild interactions here, but as I do this, I'm flexing and adducting. And then I'm abducting and extending, and then adducting at the end. So it's like extension. Right now, I'm adducted and extended. Then I'm abducted as I go into flexion. Then I'm adducting into flexion. And then I have to flip that and do it all again as I take another step. So one leg behind me, but that's how we can try to get these abductors and adductors cued relative to the hip flexion and extension pattern. And all we have to think about is keeping the foot pointed forward and swinging it back and forth. And so we get a cool dynamic where this leg, if we can graduate from contacting, we're getting all this isometric stability here. Now these muscles are functioning for postural stability, while the other ones are learning relative to gait mobility. And then we flip that, and you see how good the other leg is. And those two exercises for the lower limb, along with foot stuff, were pretty much the biggest ones I tended to show people, is make sure they have this, maintain dorsiflexion, maybe toe stuff. The only other one that can be pretty important for the knee thing, a lot of the anterior knee issues are common. Instead of, like, if I do this, I'm not really isolating the knee in that movement. I'm incorporating its action with the hip. So instead of doing that, it's this. So I don't want my hips to flex forward. So ideally my knees stay right in the same plane. And then you should really feel a difference. Like my left knee is tighter. So I know there's something up in kind of my left leg adapting. And there's, nobody's perfectly symmetrical. But if I'm the client or if you're the therapist observing, they'd be like, well, there's obviously something a little bit tighter here in my left ankle to my left knee, and how that is all, compensating. But just this action right here, to try to keep this freed up and training the knee to do these, and any of these joints to do these actions where they're not independent, or they're not cooperating with the others in a kinetic chain pattern, right? We're trying to isolate the ankles or isolate the toes, trying to just isolate the knees, isolate the hips. And then we can see if there's issues, or we can work on it by going, well, do a few more, we'll do this.
So that's an assessment. It's a pre-assessment and a post-assessment. You'd be surprised. You do that ahead, those three simple moves. Then you just do a good massage.
And then see what happens.
And come back and see what happens.
And then it becomes their homework. And it's easy homework. What I like about it's not dependent upon having like a big thing to stretch on like this or anything like that. The hip flexor thing is a challenge, and we'll look at that further for like self-care and everything of how to maybe keep this freed up. But that is a little bit more of a challenge. If somebody's hypermobile, like I can find a stretch here. But if somebody's very hypermobile, they might have a challenge with feeling like they can get a decent stretch there.
Well, Don, do you feel better now?